chief medical correspondent, Dr. Jon LaPook, is here with more on the case of Ebola in New York. Good morning, John.
Good morning, Anthony. Yesterday, I sat down with Dr. Mary Travis Bassett, the commissioner of the New York City Department of Health and Mental Hygiene, to discuss this latest Ebola case. People are wondering, well, this is a physician. He knew about the spectrum of symptoms. Shouldn't he have, in retrospect, have said, gee, night before I'm not feeling so well, maybe I shouldn't go out bowling, I shouldn't be on the subway?
You know, he didn't have a temperature. He was going out and about, but only seeing a couple of friends. And he was checking his temperature every day. The first time he had a temperature elevation, he did exactly the right thing.
What do you say to the person sitting next to them who's worried, oh my gosh, they have symptoms, they don't realize it yet, and I'm at risk?
It's the body fluids of a person with Ebola that are the source of risk. And if somebody gets increasingly sick with Ebola, they lose just phenomenal amounts of fluid. These are people with, you know, vomiting all the time, lots of diarrhea. They may even start bleeding from their mouth, from their nose. These are desperately ill people. These aren't people getting on the subway, and those are the body fluids that you need to worry about.
John, people in New York are still concerned about, where this doctor went and the possibility of exposure. Seriously, how high is the risk here?
I think all the experts are saying it's extraordinarily low to people who were not in direct contact with him, because he was not having body fluids that were being expelled like diarrhea or vomit or things like this. Remember, we keep saying over and over again that everything we know from the last 40 years is you have to have direct contact with body fluids, number one, and that it's not spread through the air. If it were spread through the air, there would be tens of millions of people, like if it were spread through the air like influenza, for example, because every year there are tens of millions of people with influenza. And if you don't sort of buy that and you just sort of want some proof, there was a great study that I found which looked at a previous episode of Ebola. It was an outbreak in Africa, and they looked at the household contacts, 78 of them, of people who lived in the house of somebody who had Ebola, the same strain as the current strain that we're seeing here. They lived in the same house, but they didn't touch them. And of 78 people, nobody got Ebola. So when you think about it, they're living in the same house. So if you're sitting on the subway and you're worried that a few hours earlier there was somebody there, you just, that should really reassure you. And the other thing is, remember Mr. Duncan, 48 of his contacts, and he was home with a fever of 103 and really sick for a few days. None of his 48 contacts tested positive. So that's reassuring.
It seems different for New York in the sense that we had time to prep. Dallas got the first case. We had time to sort of run our drills and see what's happening. Now we're the ones saying, let's put a quarantine on anyone who's coming in. Will other states follow suit?
You know, that's going to be up to the state on a state-by-state level. But I'll tell you, I spoke last night to the CDC, and the CDC has a concern about about the balance. They want to create the correct balance because the feds, the government, are going to come up with their own guidelines. And it's a balance between, on the one hand, creating safety for people, but on the other hand, you don't want to set up a situation where it's hard to give aid to West Africa. Because, for example, the aid workers who are going out there, if they hear, well, I'm going to be put in quarantine for 21 days, they may say, you know what, I'm not going to go out there. So the big thing, everybody, the punchline of all this, the bottom line, if we want to be safe here, we've got to get rid of the epidemic in West Africa. And for that, it means sending a lot of people, a lot of aid, and a lot of other things over there.
Very reassuring to hear you also say we can't get it from touching someone, something that an Ebola patient has touched.
Yeah, that's very important for people.
Dr. Jon LaPook, thank you so much.